parental care and of abuse is becoming clearer from the fundamental research point of view, and hopefully this brings pressure on us to change our social and legal systems. Our next speaker will be David Finkelhor, who's a professor of sociology and the director of the Crime Against Children Research Center.
Okay. I'm recovering from some back surgery, so I got a lot of help getting up here. I'm appreciative for that, and I appreciate Vicar for inviting me. I saw my doctor this week, and I was very pleased to hear that my condition is not the result of too many years of groveling for government grants. I like to formulate this issue in a somewhat stark way. Highlight something that we didn't learn in our college courses on criminology and sociology. And it's that children are the most criminally victimized segment of our population. They suffer from higher rates of crime than do adults. And they suffer from all the kinds of crimes that adults do, and a whole lot that are specific to their condition of childhood as well. One dramatic illustration of this comes from the National Crime Victimization Survey, which is probably our nation's most large-scale and long-term assessment of crime exposure. Surveys of over 100,000 families that are done every year by the Department of Justice. And they show that youth between the ages of 12 and 17 have rates of serious crime, aggravated assault, rape, robbery, that are twice as high as that of persons over the age of 18. And they have rates of simple assault that are 3 times as high. And this is kind of, police level kinds of crime. It is not the case that these violent victimizations are less serious than the kinds that adults suffer from. In fact, when you look at whether a weapon was used in the commission of a crime or whether injury occurred as a result of the crime victimization, here again, children are 2 to 3 times more likely than adults who have had these serious kinds of crime victimization. The NCVS National Crime Victimization Survey also shows, I think, something very interesting for us adults about this crime exposure, and that is that the rates are such that children in rural areas are as high or higher in their victimization as adults in urban areas. That is to say, for them, growing up in New Hampshire would be like, for me, growing up or living in Boston or New York. Children are not as protected by geography and social class as are adults. So it's kind of sobering that this issue hasn't been raised very substantially in our discussions of crime and in the way we teach about crime. And it is also very sobering when you come to recognize how much of the victimization of children actually is not really even assessed in a way that we could judge how much total crime young people experience. So for example, the newspapers are filled with stories about children who are molested or sexually abused by adults. It's absolutely incredible to me that we do not have national statistics that tell us how many children in total in the United States are molested by adults. That is not a number that you can get from any particular source. There are things like the number of children who experience sexual abuse that's substantiated by child protection agencies, but that doesn't cover a lot of the sexual abuse of children that doesn't go through child protection agencies and that is reported to law enforcement. There are other serious kinds of crimes against children for which we have no regular national estimates. For example, child abduction, something that is feared by many parents and children. I get calls from reporters around the country all the time when there's a case in their locality. How many abductions are occurring? Are we seeing an epidemic? We don't know. We don't keep those statistics. Abuse by teachers, clergy, youth, children and youth serving organizations. We have no idea how many children are abused in those situations. Children exposed to domestic violence. How many kids are bullied every year? The list goes on and on. By contrast, I like to put up this slide that shows 60 conditions that are monitored by the Center for Disease Control, Jim's venerable organization there, where public health officials around the country provide reports to a national agency, and where this can be tracked, and graphs made of these occurrence in different geographic areas, the vulnerability of different segments of the population. Conditions you've never heard of, I'm sure, are on this list. But some of the basic and most fundamental components of children's exposure to violence and victimization we simply do not keep track of in this country. It's really quite, I think, a sad commentary. Now, one of the things that I think has kept a more complete assessment and awareness about the degree of exposure that children have is the fact that a lot of these things that happen to kids are really dealt with, studied, and responded to by disparate groups of people. So, we have a whole mobilization about bullying, we have mobilization about physical abuse. If you're curious about what this is the Balkan region of the world, and I like to put this up as a kind of illustration of the balkanization of this whole field. And these are separate groups of people who have not really come together fully to make the point that, taken as a whole, children are extensively and unusually vulnerable to violence, victimization, and abuse. It was to kind of counteract this fragmentation or balkanization that I've developed a concept called developmental victimology, which tries to bring together all of these different disparate fields and look at the exposure of children to different kinds of victimization, how that changes over the course of the lifespan. One of the tools that we've developed to kind of implement this vision is something called the Juvenile Victimization Questionnaire, which is an instrument that tries to assess the full range, a comprehensive spectrum of victimizations that kids experience. This is the 34 different kinds of victimization experiences that we assess in one version of this questionnaire. That includes some things that are quite common, things that are quite rare, but grouped in some of the categories that reflect the current special areas of interest that a lot of people in this field have. With money from the U.S. Department of Justice, under its Defending Childhood initiative, we have been able now to go and survey children and their caregivers across the United States using this instrument to find out more about their exposure to different kinds of violence and victimization. And we have data most recently from a survey that involved the experiences of 4,500 children, where we interviewed the young people themselves, if they were 10 to 17, where we interviewed the caregivers about the experiences of the children 0 to 9. And we've been able to provide a kind of comprehensive perspective on this. The study, the National Survey of Children Exposed to Violence, which has already been alluded to, found that if you look at any of these exposures, which include a very broad spectrum, including some that are a fair amount of peer victimization, 61% of the kids had been exposed during the last year. But if you look at some of the specific kinds of victimization, you can see 6% had experienced sexual victimization, 10% a maltreatment episode at the hands of a caregiver, a quarter had witnessed some kind of violence in their home or in the community in the course of the previous year. There's a lot of detailed information in this that I think is available in your handout that you can look at. It's a very good resource if you're interested in trying to draw attention to specific kinds of victimization. My own interest is in particularly trying to understand more about the intersection of these kinds of experiences. One of the things that's very interesting, of course, is that if you have any one of these kinds of experiences, you're considerably more likely to have others. And there is a tendency for these kinds of victimization exposures to congregate among certain individuals. This graph shows the developmental trajectory for some of the aggregate types of victimization. So for the first time, we can see how victimization extends over the full life trajectory. There's some that become more common as kids become teenagers, like witnessing violence. But there's some like physical assault, which are quite common across the whole spectrum. It clearly shows that studies like the National Crime Victimization Survey, which just survey 12 to 17-year-olds, really don't do a good job of presenting the picture for children younger than that. There was an assumption, perhaps, when that study was developed, that they didn't need to assess crime victimization for younger kids because it wasn't a significant problem. But on the issue of the intersection of these victimizations, one of the things that we found that I think was most interesting, how for about 10% of the sample, they had experienced 7 or more over the course of just a single year. We've called these kids polyvictims, and they have levels of stress symptoms that are exceedingly high, and they account for a large part of the association one sees between individual kinds of exposures like sexual abuse or bullying, because the kids who are manifesting the most stress are the ones who've experienced sexual abuse and bullying and exposure to domestic violence in the household and witnessing violence in the community and so forth. And these are some kids that we need to pay particular attention to. I'm gonna skip over this because I think Jim is going to talk about some of the important priorities in terms of prevention and intervention. I want to talk about something else that we really, I think, need to be paying more attention to, and that is the fact that we have been making substantial progress. It's easy to hear about all of the epidemic of violence and the impact that it has on children and get kind of discouraged. But since the early 1990s, violence has been decreasing in the lives of children according to a great many indicators. This is a slide that shows a summary from 26 surveys that cover this time period and 10 official data indicators, things like the Uniform Crime Report data, the National Child Abuse and Neglect Data System, and show that crime exposure and victimization exposure is down for children by almost 50% during this time period, with a very marked decline during the 1990s. This includes a 61% decline through 2009 in sexual abuse substantiations. It includes a 55% decline in physical abuse substantiations. And one of the things I think is really incumbent on us is to be talking about and studying what it is that has been so effective in reducing these indicators. The criminologists and sociologists who talk about this are not in agreement about what exactly is going on. We need a lot more information. Here are, I think, 7 possible factors that have combined to play a role, including some of the economic improvements that we saw in the 1990s, the large increase in law enforcement and child protective staff who were mobilized around these issues, development of more effective and evidence-based interventions, the dissemination of more effective mental health treatments, including psychopharmacology, which we now see in the most recent report is being taken by over 10% of the American adult population, maybe as much of the juvenile population as well. Better and more effective policing and prosecution. A lot of education that's happened in this area that's changed norms and awareness. And the fact that we now have technologies, I think I'd like to point out that the judge in Texas was kind of a Rodney King moment for the children of the United States, in that we saw a parent finally getting caught in their abuse of a child, and I think has had and is going to have a dramatic impact on people's awareness about just what it is that children suffer. And example how our digital age actually does, in some ways, help to protect children. I think that's given us a fair amount to think about. I'm going to take some questions if there's a little bit of time. Yes?
The chart that you listed that indicated that 6% of children ages 0 to 17 have experienced some form of sexual
Victimization, yeah.
victimization. And you indicated, we'll turn this on. Are there gender breakdowns for that number? That's on an annual basis?
That's on an annual basis.
It's a stunning...
No, that's not the same as sexual abuse or sexual assault. It includes the category of sexual harassment.
Okay.
So if you look at the specific cases of sexual assault, it's in the 1 to 2% range. But there is a gender difference, and of course it's much higher if you look at the 14 to 17-year-olds. It's in the range of 15% for the females.
I'm wondering how the study broke out, because so much of bullying has a sexualized nature to it, and would that show up in that percent? I mean, that's obviously sexual harassment, but it could also be characterized as peer harassment.
Yes, there's a considerable overlap of sexual harassment and bullying, but that also varies according to age. It tends to be more associated with bullying at older ages, less of the sexual harassment component in the bullying at a younger age. Yes?
You mentioned digital age. So in your opinion, do you think that children are being victimized by media content? Can we associate media with abuse?
This is the question. We do not specifically study the we do not count exposure to media violence in what we're talking about when we talk about exposure to violence. There is some research that suggests that among some kids, exposure to violence can contribute to their aggressive behavior. I don't know that there's any research, but I could be mistaken about this, showing that exposure to violence has negative psychological effects in general, aside from this aggressive behavior among certain predisposed children. But it's something that is a very, very heavily debated issue.
I think we'll move on to the next speaker, Dr. Straus. I think what we've heard so far is two practical steps that can be taken, given that the biological mechanisms are becoming revealed on the consequences of violence. We can start exploring, have a call to explore how those might be mitigated. And as you've heard, we need better data gathering systems at the national level. Dr. Straus is the professor of sociology and co-director of the Family Research Laboratory at the University of New Hampshire.
Thank you. Let me just get to my... Okay. As you can see, I'm going to be talking about spanking by parents, and which I call the primordial violence, because it starts for about a third of American children in infancy, before age 1. But looking over the program, I was glad that our first presentation mentioned spanking because perhaps a better title for this would be Spanking the Missing Person from this meeting, because no one else is addressing it. And it is the most prevalent form of violence experienced by children around the world. Now, I've talked to hundreds of parents who say, well, spanking isn't violence. I'm not violent to my kids. I just spank them when necessary. So you have to decide for yourself whether a swat on the butt is violence or not. And in deciding that, just think about someone 3 times your size who gave you just a swat on the butt. And if you still think it's not violence, then that indicates something about the cultural standards of our society and what we define as violence, rather than the physical act. Well, I'm going to address 7 questions. What % of parents spank and how often? Does spanking really have harmful side effects? If spanking is done by loving parents, is it still harmful? Is spanking sometimes necessary because it works better than other methods? And then the question thing that I get all the time, I was spanked, but I don't have all these problems. How can that be? Is it ethical to advise parents to never spank? And is attempting to end spanking realistic and practical? So what % of parents spank? Here's the results from one of our national surveys of a nationally representative sample of US children. And you can see that more than a third were hit as infants before age 1. Over 90% hit when they were toddlers. Even by age 13, it's a third. And for some kids, it continues until they leave home. Here at age 16, 1 out of 4. And how often do parents do it? Far more often than they think. People don't keep a tally of this. It's literally and figuratively an everyday event. Here's results from studies showing an average of 2 to 3 times per week, and in my opinion, those are considerable underestimates because parents don't keep a tally of it. Now, getting back to the question of, is spanking a child to correct misbehavior? If spanking to correct misbehavior is violence, then we have to say that children in most of the world are brought up more violently than is generally realized. In the USA, for example, spanking is more prevalent than most people realize, including child psychologists. Over 90% of toddlers are spanked. It's more chronic, an average of at least 3 times a week for toddlers. It's more severe. 28% of parents use a belt or paddle or hairbrush. This judge in Texas that used a belt was not that rare. I think he was more rare in how going on for at least the 7 minutes of that awful videotape, which was very hard to watch. But 28% use a belt or paddle or hairbrush, something like that. Longer duration than most people realize. It goes on for 13 years for a third of US children. So I conclude from this that more children are victimized by spanking than by any other form of violence, and that's why I call that the missing person from this meeting. Now, it is included in the Adverse Childhood Experiences survey and many other surveys. In fact, there are hundreds, maybe 1,000 at least, surveys in which spanking is one of the items. But you can't tell anything about spanking from those surveys because they give you the results for the composite, which consists of spanking plus a dozen other things, and you don't know just what effect the spanking part of it has. So question 2, does spanking really have harmful side effects? Here's a summary of a meta-analysis of 88 studies. Unusually high agreement between these studies compared to other studies in child development. 93% agreement on harmful effects, just less moral internalization, 87% agreement. More aggression in proportion to the amount of spanking, 100%, every single study. More delinquency in antisocial behavior, on and on. I'll go to the next slide because of time constraints, but you can get this from me. Just Google my name and you'll get to my website. It's also effects, these are effects on children, but effects on adults, more aggression. For example, more hitting of dating partners, marital partners, cohabiting partners. Every study, and there's been double this number since that meta-analysis was published in 2002, every single one of them, without exception, shows more hitting of partners in proportion to how much spanking was experienced as a child. And as I've said, it's probably the largest single risk factor, I haven't covered this, for physical abuse. About 2/3 of cases, there are 4 different studies showing about 2/3 of cases of physical abuse that come to the attention of Child Protective Services started out as spanking and then escalated into injury. So the adverse effects are not only directly on the children, but increasing their exposure to much more severe assaults. Now, only a minute, tiny fraction of spanking results in physical abuse. Very tiny fraction, but 2/3 of cases of physical abuse started out as spanking. Does spanking teach him a lesson he won't forget? Yes, but the opposite of what parents intended happens more often. Because a specific thing, like clean up your room, that is learned. But along with that, we get an increase in the probability of subsequent antisocial behavior and delinquency. Here's an example of a longitudinal study that my colleagues and I did over a 2-year period, studying a national sample of children. And here, this is the 0 in the vertical axis is no change. So in antisocial behavior compared to other kids. The non-spanked kids went down in antisocial behavior. The spanked kids all went up in proportion to how much. This is the best kept secret in American child psychology, that children who are never spanked are the best behaved. They're not kids out of control, but they're the best behaved. Some are out of control, but so are some kids who are spanked. But on average, they are the best behaved. Here are 4 of 15 longitudinal studies. I don't have time to go through them, but the importance of these are that these are all longitudinal studies that controlled for the level of misbehavior that led the parents to spank. So these studies are all studies that show you whether spanking results in an increase in misbehavior rather than a decrease. There are 15 such studies now. If spanking is done by loving and attentive parents, is spanking harmless? Well, looking at the effect on delinquency, the percent of delinquents is less. Here, the bottom is the high positive parents. Their high positive parenting results in less delinquency. A large difference, a very important difference. But regardless of whether there's a lot of positive parenting or very little, the more spanking, the greater the probability of the child getting in trouble with the law. Question 4, does spanking work better than other methods? Well, in order to understand this, you have to understand that with a 2-year-old, nothing works. The recidivism rate for whatever a 2-year-old is corrected for is about 50% within 2 hours and close to 100% in the same day. So when parents say no or provided some other activity or explain and the child repeats the crime, they think, this isn't working, I guess I'll have to spank. But if they would do the same thing for spanking, they would find the same result. Here's the number of hours to repetition of the misbehavior for spanking only, 5 hours. They're all about the same. None of these are statistically significant differences, even this one, which is high use of reasoning and non-corporal punishment, which is the longest delay before repetition, but it isn't statistically significant because the sample size for this study was small. So question 4, is spanking sometimes necessary? No, it's not. It does work, but no better than other methods of correction, and it has these long-term harmful effects which make it less effective. There's been more than 100 studies that found spanking is associated with a subsequent increase in behavior problems. There have been no studies which have found that spanking is associated with a subsequent improvement in child behavior problems. Not a single study. Question 5 is, if spanking has harmful side effects like physical aggression, how come I'm not physically aggressive, don't have all these other problems, no crimes committed, so forth? Well, you have to remember that spanking, like almost everything else we study in social science and medicine, has a risk factor relationship rather than a one-to-one relationship. For example, if you're a heavy smoker, are you going to die of a smoking-related disease? Well, 1/3 of heavy smokers will, but 2/3 won't. That 1/3 is pretty awful, but it's still, the other side is pretty good. 2/3 won't. Binge drinking. In our research, we found a 3-fold increase in assaulting a wife by men who are binge drinkers. So it goes up from 6-7% to 19%, but 19% means that 81% of binge drinkers do not beat their wives. Frequent spanking and delinquency, the same risk factor rather than one-to-one relationship. Question 6, is it ethical to recommend never spank if the evidence of serious harmful side effects is strong, but not absolutely conclusive? And it's not absolutely conclusive. There have been no randomized trials assigning people spank or not spank, which is conclusive evidence. Just as there have been no randomized trials in which people have been assigned to smoke heavily and not smoke heavily, but we still conclude that it's a cause of many smoking-related illnesses. So, but the evidence is pretty strong, even though not absolutely conclusive. So the general principle is, if there's an equally or more effective alternative that don't have the side effects, then it's not only ethical, but it's morally required. You wouldn't, if you were a physician, you wouldn't prescribe a drug with known side effects, even though that drug worked, if there was an alternative drug that worked but didn't have the side effects. And question 7 is, attempting to end spanking realistic and practical. Sweden was a high spanking country in the 1950s. Well, 97% in one study in Stockholm, and most did it at least once a day. It's now become a nation in which there's very little spanking. There's different estimates, 10 to 30%, but let's say 20%. It's been very successful. And we have the United Nations and the European Union asking all member nations to ban spanking. 24 nations when I made this slide up, about 30 now prohibit parents using spanking. It's part of a worldwide trend to more humane social relationships in which children are finally getting the benefit. In my opinion, ending spanking will happen sooner or later. If sooner, children, families, and the entire nation will benefit sooner. Thank you.
We have time for a few questions.
Yes.
Can you hear me from back here?
Try the switch.
The switch. Oh, there we go. Okay. Thank you. One question that I have is about the term itself. When we say spanking, it's my opinion that we all have a different idea. And when I talk to people about it, some people say, oh, a child is spanked when we tap their hand away from the hot stove. That's a spanking. And then if you watch the video of the family court judge, he was a family court judge, you hear him say at the beginning, oh, I'm going to spank her. And then he comes out for the next 10 minutes or so, full force, as strong as he can, in my opinion, swinging at his daughter rather indiscriminately, I think. But when you look at it, they both use the same term. And I wonder if that causes a problem for us when these two children now in the future are going to say, oh yeah, I was spanked and I was spanked. One was tapped on the wrist and one was beaten for 10 minutes.
That is a problem. And the only solution I know to the problem, at least for research and probably in practice also in policy, is to ask multiple questions. So, for example, in a recent analysis, I compared a study in which the question was only, did you spank the child? With another study that asked two questions, did you spank, second question was, did you slap? And the rate was twice as high for precisely what you mentioned, because for many parents, what they do is slap on the hand, particularly when it's an infant or 1 or 2 year old. So a better term would be corporal punishment, and for many years, in fact until a year or so ago, that's what I used all the time. But I found people didn't recognize what they were doing as corporal punishment. And so the lesser of two evils, in order to have people understand that what I'm talking about is legal and morally correct and expected behavior by the parents, I found it better to use the term spanking. Yes.
Hi. My question is, in the countries where it has been banned, 24 is a lot of nations, are there actual policies or UN policies about figuring out what the alternatives are? Because many parents really don't want to spank, but they have no idea what actually works, and they're told spanking does not work, but they don't know what to do.
Well, a lot of people are going to be offended by what I'm about to say, but parents around the world all use alternatives, even those who do the most spanking. There's almost no one who spanks, only spanks. If they just left out the spanking part, their effectiveness as parents would hugely increase. Just left out the spanking part and did as consistently as they spanked these other things, like explain, move the child, impose penalties, nonviolent penalties, things like that. So parents do need help. They do need more skills. All parents do. I don't mean that's not necessary, but we don't need to and shouldn't wait for that. We should stop hitting kids now, everywhere. Yes?
Spanking is a cultural part of many countries' cultural
Yes.
behavior. Is it possible to use, I guess through the UN, which is what I teach at the UNCRC, to have educational programs, because this is going on for generations and generations, and my students tell me that they have since they were beaten from neighbor to neighbor or village to village till home, from school to village to home, that they don't see any other way in controlling their children in the American culture. Have any of your studies been done elsewhere?
There have been quite a number of studies now, and they show that regardless of culture, spanking has an adverse effect on children. If it's culturally normative, the effect is less, but it is there all the time. The idea that culture can make bad things right is just a big mistake. In societies that practice female genital mutilation, that's part of the culture. But we're not going to say because it's part of the culture, and it's something that women insist on in those countries more than men. So culture has tremendous impact, but it can't undo things that are fundamentally harmful to human beings.
Thank you very much.